Around 10 lakh people in the country are suffering from corneal blindness.
What is cornea for that matter?
Pledging means just expressing your wish and desire to donate your eyes after your demise. This is an important step but not absolutely mandatory. Even if there are two ways, you can either remove the entire eyeball or even just what we call as the corneoscleral rim.
Hardly takes any time. The process takes 15 to 20 minutes. So if your concern is that it's going to waste a lot of funeral time, no, that is not true. Hello everyone, welcome to the episode. This is a special one where we dive deep into concept which holds immense importance in our society, eye donation. In a country like India where millions are suffering from blindness, an act of eye donation can be the gift of sight. It can be a gift that transforms life. In spite of the dire need for eye donation, there are so many myths and misconceptions around it, which makes the whole process even more difficult. So today, to explore this topic, we have the renowned ophthalmologist Dr. Swathi Mailankody with us, who will shed light into this topic of eye donation as to how it works, how each one of us can make a difference. So stay tuned as we explore this topic and as we understand how this simple act of eye donation can help someone to see a brighter tomorrow. Hello, Dr. Swathi. Welcome back to the channel.
Thank you.
So without wasting any time, let's directly dive into the topic. So tell me, what exactly is eye donation and why is it important?
So according to the latest survey in India, nearly 50 lakh people are suffering from blindness. So among this, in the age group above 50, cataract is the most common cause, followed by something what we call as corneal blindness is the second most common cause for blindness. And in the age group below 50, corneal blindness is the most common cause for blindness. Roughly around almost 10 lakh people are suffering from corneal blindness in both the eyes. And when we talk about eye donation, it is this group of people who have corneal blindness. They are the ones who are benefited from eye donation.
So you are stressing on this word corneal blindness. So many of our viewers may not be aware about what is corneal blindness and what is cornea for that matter. So can you explain in detail as to what is cornea and what is corneal blindness and what are the reasons for it?
Yes. So cornea is this transparent outermost layer of the eye. It's the front portion of the eye. You can say it's like the window of the eye. So the light rays enter our eye through the cornea. So due to any reason, if this transparency is lost, then it can lead to corneal blindness. So this is the subset of disease, eye disease, which can be treated by eye donation. So if there are multiple causes for corneal blindness, most common cause is eye infection, what we call as a corneal ulcer. It could be a bacterial infection, fungal infection, viral infection, etc. So this infection, as it heals, there is scarring, and this leads to corneal opacity. So the front part of the eye, which is normally transparent, ends up being very opaque, and hence light rays will no longer be able to enter into the eye. Therefore, the patient cannot see clearly. This is called as corneal blindness.
So just to reiterate whatever you told, let me just re-clarify this. So what you're saying is this process of eye donation will help only in these kind of blindness. It is not going to help if the blindness is because of glaucoma or cataract or one of the other common ones, diabetic retinopathy. So these kind of patients are not going to be benefited by eye donation.
No. So any other pathology of the eye, say any nerve related issue or retinal issues, these cannot be treated or cured by eye donation. So what we do is a corneal transplant. Only the cornea can be of one person can be transplanted to another patient. So only these cases can benefit from an eye donation. But even the load of these cases are quite high.
Yes.
Almost 10 lakh people in our country are suffering from corneal blindness in both the eyes. And when we look at the numbers of eye donation, we get about 25,000 donations a year. So that is about 50,000 corneas, two corneas per donor. So that is about 50,000 corneas. So you can look at the gap between
it's
the
only serving 5% of the
exactly.
load.
So the requirement is much higher than what we are actually getting. So this is where we need to work, and I think if more people come forward and more people are aware about this topic, we can try to bridge this gap.
So can you explain this process of eye donation, like as to how exactly it works? And another important aspect is obviously the donation is after death. So who has to give permission to that? Who has to give consent? Is it the family members, or is it the prior consent which the patient has given before death? So how it works actually? Can you explain in detail?
So the first step is what we call as pledging your eyes. Any person who wishes to donate his or her eyes after their demise can pledge their eyes at your nearest eye bank. So first you need to find which is the eye bank closest to you. You can either approach them directly, or you get the pledge forms even online in most of the eye banks. So you fill that form and submit it. Pledging means just expressing your wish and desire to donate your eyes after your demise. This is an important step, but not absolutely mandatory. Even if you don't do this step, you please inform your immediate family that you have this desire of donating your corneas, and ask them to do the needful after your demise. Then next step is after a person's demise, the responsibility is on the next of kin, that is their immediate family. It could be the wife of the patient, or the spouse of the patient, or the children. So the responsibility is on them to inform the eye bank immediately and make the arrangements for eye retrieval. Once the eye bank has been informed, immediately they send their team as early as possible. So ideally, eye donation has to be done within 4 to 6 hours after death. So there should not be any time lapse anywhere. The family should inform the eye bank immediately, and the eye bank sends their team as soon as possible. The team would come to the place. It could be the hospital or the house where the patient, the person is kept. Once the eye bank is informed immediately, some instructions for the family at home is: one, to switch off all the fans, and if you have an air conditioner, you can keep it on to keep the body cool. Keep the eyes of the deceased person closed so that the corneas do not dry up, and you can even keep a moist cloth or a moist ball of cotton over the eyelids to keep the eyes moist. It should not dry. You can raise the head a little bit with a pillow, so that this reduces the chances of bleeding during the procedure. So these are a few instructions to the family of the deceased. Then the eye bank team will come immediately. The whole procedure would take about 15 to 20 minutes only. So one misconception is that all these procedures and formalities would take time, and it would delay your funeral arrangements. But like I said, it just takes about 15 to 20 minutes. So nothing gets delayed. Once the eye bank team has arrived, first step is to take an informed consent. Like I said, the family has to consent. Even if a person has pledged his eyes before he dies, if his family does not consent for it after his demise, then eye donation cannot happen. So the team will explain the process to the family and take a written consent from them, and only then they will proceed forward. So there are two ways. You can either remove the entire eyeball, or even just what we call as the corneoscleral rim. There will be absolutely no disfigurement of the face, or no external evidence that a procedure has been dane. That is another concern that
I think that's very important. People will be bothered about that, I guess.
Yes. So there will be no external sign of any procedure done, and utmost respect and care is taken. It is all done under sterile conditions, like how you would do a surgery. And at the end of the procedure, an artificial eye, if the entire eyeball has been removed, an artificial eyeball is placed and the eye is closed. so that there is no disfigurement.
So most importantly, you're saying that if the death happens at home, it will be done at home. Don't need to carry the body anywhere. Just wherever that patient is, they will just
Yes.
come and do it within 15 minutes.
Yes, not
Most
at all. You don't have
importantly-
to take the person anywhere.
Yes.
Wherever you are, the eye bank team will come there and do the needful.
In 15 to 20 minutes, so that there is no delay, and most importantly, there is not going to be any significant disfigurement.
Yes.
If people are
So
bothered
the
about
procedure
that.
will take 15 to 20 minutes. The total time may depend upon the distance between your
Yeah, obviously.
place and
Yes.
the eye bank.
Yes.
Because some places may be a little far off from your closest eye bank. But ultimately, we try and see that the whole process should be completed within 6 hours after death.
See, whenever we talk about this, some people tell us, reasons like their vision is already low, so they may not be eligible. Or some people say they are diabetic, or they have X and Y medical problems, so they may not be eligible. So tell us exactly who are eligible for eye donation. Is there any age group like only above this or beyond this can donate? And any diseases which make the person ineligible for eye donation?
So there is no age bar, no sex bar, no religion, no caste. Any person of any age, maybe less than 1 year old, we do not generally take. But any person above 1 year, even up to 100 years, they can donate their eyes. Even if a person had spectacles during their lifetime, has undergone any eye surgery, or was suffering from diabetes or hypertension, there is no contraindication. All of these patients can also donate their corneas. Very few exceptions are if they are suffering, if the death is due to any communicable disease like HIV/AIDS, hepatitis, sepsis, and other conditions like syphilis, rabies, some brain infections like meningitis, encephalitis. These are some contraindications because there is a risk of spreading this infection to the person who has received the cornea. Okay. Also, end-stage cancers, blood cancers. These are also some conditions where we may not be using these corneas to transplant to other patients, but sometimes we do retrieve corneas from such patients if they opt for donation. But such corneas will be used for research and training purpose, which is also very invaluable.
So basically, you're saying there is no age bar, like even a small child or even an elderly up to 100 years can donate.
Yes.
Like, can you recall any incidences of extremes of age donations that you have carried out?
Yes, I think the youngest patient in my experience, what I saw was a 4-year-old child, and the oldest was probably around 90 years old. So along with the eye retrieval, the eye bank team will also draw a blood sample of the deceased person to test for any communicable disease. And only after ruling out all the the medical contraindications that I mentioned, the cornea will be further processed and used for a transplant in another person.
So tell me one thing, like you told that after the person is deceased, it has to be retrieved within 4 to 6 hours.
Yes.
So an immediate question that comes in my mind is that the recipient, will he be also ready at that time for the transplant to happen? Or how exactly it goes? Like once it is retrieved, should it be transplanted into the recipient's body immediately, or it will be stored somewhere? Second thing is that the cornea which is removed, do you do any kinds of test on that to see if it is eligible for transplant? Or in other words, every cornea that is retrieved, it's eligible for transplant? Or there are some scenarios where you have retrieved the cornea but unfortunately it cannot be transferred on to recipient's body?
So immediately after the retrieval of the cornea, we store it in what we call as a storage media. There are various types of storage media, and each storage media has a different duration for which you can store in it. Okay. So we use this storage media, and then we send it to the eye bank. In the eye bank, you can keep it for a particular number of days depending upon which media it is. So even up to a week, you can store it that way. And meanwhile, you have a wait list of the patients who are waiting for a cornea. So you see which of these patients may benefit, or this cornea may help which of them, and then you contact them and arrange for the transplant accordingly. You are asking about the examination or
Yes.
some tests which
Tests
are
on the
done on
cornea.
the cornea. Yes, definitely that is done. In the eye bank, they do a microscopic checkup to see what is the quality of the cornea. And based on that, they will decide, for some conditions, you need a very good quality cornea. Or if you're doing it in very young patients, you may need, there are some particular criteria depending upon what is the condition you're treating. Based on that, they will decide if the cornea is fit or unfit. Yes, very occasionally some corneas do happen to be unfit and may not be used for the transplant. Another thing I wanted to point out here is that the various conditions which cause corneal blindness, they may affect only some part of the cornea. Our cornea has multiple layers. So some conditions in this affect only a particular layer. So in such cases, what we can even do is a single donor cornea can be split into two, and we can use only that layer which we require in this particular patient. Therefore, the other layers may be even used for another patient.
person.
So effectively, one cornea can benefit two patients, and one donor can therefore benefit four patients. You may have heard, that Puneet Rajkumar had donated his eyes. So it had come in the news also that it was subsequently used for four patients, and four patients are today seeing this world because of his eyes.
So something like blood donation, how the blood different.
Yes, you can separate the components. Here you can separate the layers and use it for different, depending upon what is the pathology, you can decide and use it for different patients.
So see, in case of kidney donation, there is a concept of donating after death as well as donating when the patient is alive, because obviously there are two kidneys. So similarly, there are two corneas. So if somebody wants to donate one of their cornea when they are alive, is there any such provision?
No. Eye donation can only be done after the death of a person. We do not or cannot retrieve the corneas from a live patient. So it is not like other organ donations. So it's only done after the demise of a person.
See, in case of kidney donation, before doing the donation, a lot of tests are done. They say that this person's kidney is not going to match because HLA is not matching, and so many other things. Probably blood group is not matching, and these kind of things. So you are saying that the donation is after death. Obviously, these kind of tests are not done. And two questions here. One is that are these matching important for corneal donation? Second thing is that the person who receives the cornea, will he know the identity of the person who has given it, or vice versa? Will the donor's family know as to who has received that person's cornea?
So cornea is a bloodless organ. There is no blood supply to the cornea. Due to this, the chances of rejection, like we see in other organ transplants like kidney or liver, is very, very rare in with corneal transplant. Since it is bloodless, there is no requirement for doing any of the antigen testing or any matching that we do generally for other organs. So any person's cornea can be transplanted to any other person, irrespective of blood group or any other HLA matching. And the other question what you asked, it is an absolute anonymous process. Neither the recipient will know whose cornea he has received, nor the donor's family will be made aware of to whom the corneas have been given, or who is the recipient of the corneas that were donated.
See, in our country, whatever the treatment, whatever the condition is, very important concern would be about cost. So can you tell us as to the cost incurred to the recipient's family, that is to have to receive somebody's cornea, how much will the patient has to spend? Second important thing is that if somebody decides that he or she will donate his or her cornea, do they have to pay anything, or do the family receive anything because they have donated? Is there any financial grant to the family, or do they have to pay? So can you just clarify these aspects?
So for the recipient, there would not be any charges for the cornea per se, but like any other surgery, the surgical procedure, or what we call as keratoplasty, that would be charged depending upon the city or whether it's a charitable or a government institute or a private institute. For the donor's family, also it is absolutely free. The donor's family is not charged, and it is a voluntary and a honorable thing that they are doing. So
they will not be receiving anything.
I don't think they would be expecting anything also, and there is no remuneration as such for this.
So few of the important points that I could understand, where I would say one thing is that after the death, irrespective of where the death was, whether it is at home or hospital, the most important thing is the immediate family has to inform the eye bank, and the retrieval has to be done within 4 to 6 hours. It can be done at home, hardly takes any time. The process takes 15 to 20 minutes. So if your concern is that it's going to waste a lot of funeral time, no, that is not true. It will be done within 15 to 20 minutes. If your other concern is that it's going to disfigure the entire face, no, nothing. It's a very simple minor procedure. It is not going to disfigure. There is no cost involved in that, and as the doctor told, most of the medical conditions do not prevent someone from donating the cornea. Another important thing is that even if a person has pledged his eye in one city, and of course if he moves to another city after a few years, it doesn't mean that he cannot do the corneal transplant over there. It is the responsibility of the immediate family members to make sure that they make that important phone call to the eye bank over there, and it is their consent which matters. So which city the patient is currently in during the time of death hardly matters. So this was a very informative session. Thank you so much, Dr. Swathi. So do you want to give any closing statement about this very important topic?
Yes. Every year from August 25th to September 9th, we celebrate the National Eye Donation Fortnight. It is just an effort to make more people aware about eye donation, clarify any myths if present, and ensure or hope that more people come forward and donate. Like I said, there is a huge gap between the demand or the requirement for corneas and what we receive from the donors. So the only way this can be crossed is by more and more people coming forward. I request all the viewers of this video to share this message among all your close family members and friends, and come forward to donate your eyes, and thereby ensure that you are enlightening and brightening the lives of other people even after your demise.
Okay, so that was very informative. Thank you so much, Swathi.
Thank you, Dr. Skanda.